On the 13th to the 17th of May 2013, the first Awareness Week on alcohol-related harm was held. The week was dedicated to drawing attention to the need for active policies to reduce alcohol consumption and to the role that the EU has to play in delivering valuable support to national governments' efforts in this area. In 2010, alcohol-related harm in the European Union cost over €155 billion. That's enough to host the London Olympics 14 times. It is a heavy cost to bear in times of economic crisis. EU drinkers consume more than 600 times the exposure level set by the European Food Safety Authority for genotoxic carcinogens, of which ethanol is one.
In Europe, we are the heaviest drinkers. We drink 2.5 times more than any other continent.
And per capita per year, this is 12.5 liters pure alcohol.
Over 12 million people in Europe are dependent on alcohol. You may know someone who has a problem with alcohol.
People with heavy drink are often living in families, and that can disrupt the harmony of a family. It can cause problems with your spouse, it can cause even violence with your spouse.
The devastating effect which alcohol misuse has on families, leading to major emotional upsets such as guilt, shame, and sometimes even leading to depression and mental illness.
There is a clear need to increase efforts to reduce alcohol consumption in Europe. Alcohol is the second leading risk factor for disease burden. Alcohol use disorders are the leading cause of disability in men. Alcohol is responsible for 3.5% of cancer deaths in the world and broadly recognized as a risk factor for over 60 diseases and disorders.
We estimated that 50 million of citizens in Europe can have some problem which has been diagnosed or maybe is not diagnosed related to alcohol consumption.
It's one of the largest causes of non-communicable diseases in Europe. It's an underlying factor. It's one of the 4 key underlying factors for things like cardiovascular disease, stroke, cancer, liver disease.
With these worrying statistics in mind, the first Awareness Week on alcohol-related harm was launched by the European Association for the Study of the Liver, the European Liver Patients Association, the European Mutual Help Network for Alcohol-Related Problems, the European Federation of Associations of Families of People with Mental Illness, EUROCARE, Alcohol Concern, and Lundbeck. All are committed to tackling alcohol-related harm and helping to develop the policy needed to reduce alcohol consumption.
What we hope is that following this week we will have a better understanding amongst our decision makers here that alcohol, if treated in moderation, is fine, but if not, then it has a significant repercussion at European level, and we have the power to do something about that.
The week saw policymakers, politicians, health advocates, health professionals and the general public all join together to raise awareness of the issue and analyse how integrated policies can tackle this significant public health challenge effectively. Events were held with representatives of the European Commission, national governments and members of the European Parliament. Policymakers consistently called for the renewal of the European alcohol strategy to reduce alcohol consumption and alcohol-related harm.